So I am delighted to be joined this evening by Sneh, who is one of our medical consultants within ARI. Sneh, is that right?
That's right, Caroline. Nice seeing you today.
Nice to see you, and we've just been having a quick chat about it being the end of day for both of us, and we're both had a busy day, but looking forward to this conversation. So, Sneh, we are going to have a conversation tonight about racism, and I wonder if you want to share with people who will be watching this video why now and what it is that you're hoping to get out of this conversation with me.
Thanks, Caroline. First of all, thank you ever so much for your time to meet me today. I mean, we both know that the Speak Up Week is coming, and I think, I mean, this interview would obviously encourage staff to speak up. Specifically, I'm working on racism, so if that helps staff to feel a safe environment, that's my aim. So as you said, I'm a consultant physician in ARI. I'm trained in ARI. All my registered training was here. I'm the Equality, Diversity, Inclusivity Champion as well, and I am chairing the Grampian Empowered Multicultural Staff Group Network, and has been doing the chairing of supportive, inclusive healthcare environment. So yes, first of all, I think I would like to ask you for everybody's understanding, like what this Speak Up Week mean, Caroline.
Yeah, so I think from my perspective, the Speak Up Week, as I understand it, was initiated by the Ombudsman, wasn't it?
That's right.
The Ombudsman Service, and it's about everything. It's about people having the opportunity to speak up about anything that is getting in the way of them being able to do what they do and to be able to enjoy being in their environment, and not just about the things that they experience, but about the things they observe. And to be honest, I think the concept behind it, which is that people don't feel that speaking up is welcomed. And we know that people find it really hard to speak up about things they observe. So for us just now, we through the work that you're doing with colleagues and raising awareness around racism as part of that is really important. But I actually think the Speak Up Week is much broader, and the important thing for us to hear and learn through this week is to really listen. What is it that people are telling us, and then to actually work with colleagues to understand what we need to do to make it better.
Yeah, no, absolutely. Thank you very much. And I think I'm in my role for last 18 months, and I have clear experience that people are scared about speaking up. Like I had chats with colleagues one-to-one because they were not coming in the Staff Equalities Network, which we have been running for many months now. And there was clear scare, like people say that if I talk about these things, like the racism I have been experiencing over years and years, I know that I have to start packing my bags because I'm going to lose my job. And Scotland is such a small place. If I lose job here in Grampian, there's no job for me. In Scotland, there is no education for my students in Scotland. So that sort of deep-seated fear. And it's not just one-to-one conversation in the Grampian ethnic minority staff group network. This fear has come as number one point. So definitely people are not speaking up. And I can see that your background is showing plan for the future, healthier together. So I'd be keen to know, like, what's there in that plan, like how you're planning to create a culture where people would feel psychologically safe to speak up racism or something like that.
Yeah, so really, really important, and I think we are a long way from where we need to be. So conversations like this are really helpful. They're helpful to me to help me understand what is the gap. So where do we want to get to, which is that as colleagues working in NHS Grampian, people should come to work, they should feel safe at work, physically safe as well as psychologically safe, and we should feel confident enough to challenge any level of discrimination that we observe. And through the conversations that you have shared with me, and through other pieces of work, so things like the I Matter process and the Culture Matters work that we've done, and indeed through programmes like Scottish Patient Safety Programme, we know that psychological safety is not embedded in health and care. So I think, what are we doing to address that? Within you've pointed to the Plan for the Future, which is behind me. So within that, one of the commitments as NHS Grampian Board that we have made is that we are going to focus on the health and well-being of our colleagues in a very different way. And that would absolutely include creating psychological safe environments. And that'll mean different things, Sneh, for different people. And I know through the work that you've been leading, you're creating networks and small groups for people to come and have that psychologically safe conversation. So there's something about normalizing, speaking up, and truly working out how do we do that. So what are the things that we need to do? So education and training. So do people, and we're here talking about racism specifically today, so I don't want to divert from that, because actually I think one of the things people shy away from the conversation because they're frightened of it and they don't want to offend people. And so actually getting an understanding of what actually does it mean, and how does it play out, and all the things around the conscious and the unconscious stuff that plays in. And so I think, first of all, getting an understanding of racism exists. We have evidence that racism exists, and
Absolutely.
If anybody needs any sort of motivation around why do they need to understand more, I would strongly advocate that they watch the video with yourself and Bianca and Ceci. When I watched that, Sneh, my first emotion was anger. I was quite angry when I listened to the three of you, and then I was disappointed, and then I managed to get myself to a place of, okay, so we understand that there is a problem. So understanding there is a problem and understanding what needs to be done about that. Now some of that will be about training and education, but there'll be other things I would imagine around that you're working on just now around how do you make it easy for somebody to say, I've experienced racism, or I've observed it and I didn't know how to handle it, and so they can go back in and do it differently. So I think that there has to be a really clear message from people like me, from people like you, to say this is not tolerated. And we need to take colleagues with us to help them understand the impact that they are having. So yeah, training, education, leadership, and then making it feel safe to share experiences, so we know when we're starting to get a shift and it's starting to change. Because from the intelligence that I have gathered through yourselves and broader, there is a big problem.
Yeah, absolutely. This itself is a big move, isn't it? Like, as a chief executive, you are here in public saying that racism exists. And yes, I mean, the national data all are saying that institutional racism is deeply embedded, and it can't be like we're different from the other health boards. I don't think we have done anything special over last decade which would made us different. So I think it's the same, that like institutional racism there. And glad that, I mean, you mentioned about the video where lots of stories were told by myself, Bianca, and Ceci. And lots of micro incivilities were there. But the other thing I wanted to highlight was the mumbles. I mean, whenever I go and speak with the ethnically diverse group, they bring this concept, like in the health board or in the higher senior management, there is no representation or very underrepresentation of minority ethnic group. So if these mumbles become, I mean, if we start to speak up in different forums, what do you think, I mean, can be done about that? Or have you got any plan, like how is this going to be addressed?
Yeah, so interestingly, we have had, so I completely agree with you. There is an underrepresentation and it needs to be addressed. And so our interim chair, actually, John Tomlinson, has convened and has been chairing a group on diversity within execs and non-execs. So that work, I need to check where that work has got to, and the intention is absolutely to ensure that our board members are as representative as we can possibly make them of our population. And we know that that is not where it needs to be just now. So by speaking up and actually being really honest that we know racism exists in our organisation, our approach to tackling that is going to be through supporting colleagues to gain an understanding through education, through and whatever route works for them, but then actually to have the appropriate representation within our board members that allows that challenge to be there. Now, we should all be champions and we will all look at it through our own lens. But I can give an absolute commitment, Sneh, that the work that has been undertaken, I think probably over the past year, is concluding, and we are about to go out to recruit to some new non-executive appointments.
Yeah.
Something that's really important for you to know is that actually the appointments that are made to the board are part of a Scottish Government process. So so there's a broader influence around that, but we will be very clear on what we are looking for in regards to diversity, and that's not just about ethnicity. It's about gender, it's about what are the skills that they bring, but we do not need a homogenous group of board members because it won't do the job it needs to do well.
Yeah, absolutely. I'm already feeling very positive, and I know it's from Scottish Government, but as you are on board, I'm sure you have got a big role within Scottish Government. So these voices would be heard there. That's my deep belief. So thank you very much. That takes me to another question. Like I think when I proactively go and hear and go to people to listen to their stories, I mean, they don't want to come with their stories. They say absolutely no. I have invited them in the staff group networks. They sometimes come and say that I'm not going to speak about my stories, sorts of things. So what would be your guidance? Like what would be the different ways like people can speak up in NHS Grampian?
So I think I'm going to just take it slightly broader actually than
Please.
racism just now, because
yes, absolutely,
it's not it's a big issue. So I think that it's really important that somehow we support colleagues to find the courage, and I think that's what it is. It's courage.
Yeah.
To speak up, and then if that is not well received or if that is not heard, then to find the resilience and the energy from within to do it again. And that's not how it should be. So I understand from the work and the groups that you have spoken about that you're establishing easy ways of reporting because that's been a problem. It's don't know how to do it and it's too difficult. So making it as easy as possible. Clearly, there's lots of different routes that people know. So things like the HR hub, your line manager, occupational health, all of these things, but there's something culturally about where do all of these places exist. So these are there. They've been there for a long time, but somehow it's not cutting the mustard really in regards to making people, creating the conditions for people to feel safe. So I think there's something about how do you get courage from peers? How do you find that safe space to have that conversation? And if the other routes haven't worked, and I am going to work with you and others, and Adam Caldwell's, who has been doing a lot of the work with you, to make sure that we get this the best we can. So if those routes don't work, then finding strength in your peers, and you know, the last gasp is write me an email. So I'm not wanting to encourage everybody to bypass all of these routes, but genuinely, if people don't feel that they have had the response that was required, then that is a last resort. The other things that are in there are things like whistleblowing and confidential contact. So
Yeah.
So I think that's really important. And I know that Tom Powers, our Director of People and Culture, has been looking at different ways of creating champions around his culture work. And I would imagine that there are synergies with the work that you're doing and the work that Tom's doing around actually how can somebody go somewhere, know that they have a safe conversation, and know that that person will know how to help them, how to signpost them. So there's definitely a cultural element. There's formal processes, whistleblowing, line manager, all of these things, and whistleblowing is clearly anonymous. But we need to do better as humans, working together to create those conditions.
Yeah. No, I mean, it's interesting. Like the line managers are there, but sometimes if the racism is coming from there, where to go, and wherever I'm going, how much training that person has got. And NHS Grampian being the biggest employer in this region with thousands and thousands of employees, like a huge amount of training is required. That's I can see. Like in regards to unconscious bias, how to even talk about race, like the race literacy, and how to be an active bystander. All sorts of trainings I think are required specifically for the managers. I mean, from another organization, I sometimes get email like, this has happened and this is not a racism at all. So, but I mean, I wonder how much training you have got to be the judge to say that this is not a racism at all. So there is a huge amount of lack of understanding in the current concept. So my worry is to train that big a cohort and then to employ some race ambassadors who would be knowledgeable. I mean, I can see a huge budget is required there. And in your plan for the future, is there something there like to motivate people to speak up and to have this training? I think so that's a huge endeavor, and how much commitment is there from you?
So from me, there is full commitment, Sneh, just to say it right up front, there is full commitment that we need to acknowledge and improve how we talk about, how we raise the profile of, and how we reduce the incidence of racism. It is inconceivable for me to think that I, as a white, middle class, Caucasian woman, could cause offence or could do something subconsciously that somebody has felt or heard in a different way. I would imagine I have in my lifetime. And I would also imagine that no, it's never been pointed out to me. So actually I go on blissfully unaware. So actually raising the awareness and really helping. I would hope, I don't think anybody would want to do it explicitly. And I think that's a different conversation. But you're absolutely right about understanding and the literacy and all the different ways that we can help people to understand. But we also need to be able to call it out when we see it, so that we can stop people in their tracks and say, are you aware of what you've just said and the impact that's just had? And so there is a really important piece of work. So your question was, what is my commitment? My commitment is full. Now, you mentioned massive budgets.
Yes.
I'm not absolutely convinced we need a massive budget around it, because actually the power in the 3 stories that I watched in the video was significant. So getting the right infrastructure, and if that is about ambassadors and champions, then we need to do that properly. But one of the things that I have made an absolute commitment to is the focus on, as I said at the beginning, the health and well-being of our colleagues. And that's predominantly going to be around our cultural environment. And for me, prejudice in whatever manner, and including racism within that, but prejudice is utterly key to eradicate. It's something that we should have no tolerance for. And so that would be the ambition. Now, how we do that, that's where I need you and our colleagues who have experienced racism to help me and to help other members in the team to work out, so what is it? How do we do that? And I know that's the work that you're doing with the university and with Adam and Tom and colleagues. So from the Chief Executive of NHS Grampian's perspective, I will not lead an organisation where there is a perception that racism is acceptable, is tolerated, and those that experience it can't speak up and indeed are in fear of their jobs. That's incomprehensible, Sneh, for me as a chief executive. I absolutely give you my full commitment around that.
Yeah. Thank you so much, and I think this would encourage a lot of I mean, stories coming out, I hope. And there's another thing you have mentioned, that reducing the incidence of racism. So first of all, having that disproportionate representation in the board or higher management, this is one of the things which is obvious, but I mean, so far I haven't seen any of the reports which are produced by NHS Grampian which highlight these issues. These are all praises, like the 4 statutory reports which go to the government, which praises NHS Grampian, but this sort of data doesn't come. And the stories which I'm talking about, they're all silent stories. I mean, until we have started digging into these things, nobody was aware of these things. So basically, there is no way to prove that the racism is getting down. So a robust amount of data collection needs to be started, and I hope that you'd do something about that as well, by speaking with health intelligence or HR. But I don't know, as a clinician, I don't know how these things work in the management perspective, but that is something very important to have more robust data for NHS Grampian as we are aiming to be an anti-racist organization.
Completely agree. And I think actually as a clinician, you have a great deal of insight into data. And so, but you're right. And let me just be clear about what I meant in regards to incidents of racism. So interestingly, I asked before this conversation if we had an understanding of the number of incidents that related to racism in this organisation. And that was interesting that I had to ask, because it wasn't something that was in the front of my mind. And so the answer that I got was it's not readily available data. So, however, even if it was, I completely agree with you. The stories that you have access to, and actually the biggest messaging that you've been giving me is that people don't feel psychologically safe to raise their concerns, to share their experiences. So actually, the incidents at the moment are kind of irrelevant. I don't mean they're irrelevant, but the recording of them actually is not going to capture the depth and the scale of the problem. So I think that through the work that you are doing, and certainly the work that Adam and Tom are doing, there is definitely something about how do we generate that narrative, the story, the qualitative data, and then find a way that will work for people who are willing to speak up to you or to me or to other champions, but don't feel able to speak to other groups. How do we start to collect that data and really raise the profile of this and make it uncomfortable?
Absolutely, absolutely. So people who are interested in the agenda, the emails actually come with these things, because that's the scientific way of thinking these things, like how many band 7 nurses are from the minority ethnic group, or how many international medical graduates are in the senior management group. So these sort of emails came to me. I forwarded to I mean, appropriate authorities. Never got any satisfactory answers, because we just don't collect data. So that's, if we want to improve our profile, we should have this data, which you have just agreed. Yeah, brilliant. Thank you. Let's ask you some positive questions, like what are you proud about in regards to EDI? As I am the EDI champion, I'd be keen to know, what are you proud about in regards to equality, diversity, and inclusivity within NHS Grampian?
So I think that I'm proud. I'm proud that we're having this conversation, actually, and I think you said it, which is that NHS Grampian's quite proactive, and so I'm really proud to be the chief executive of this organisation because of the people that work in it, and that's it, full stop. But actually, around the EDI agenda, I think that around about the gender, the gender and work that we've done around that. I've been delighted in how we have shown up around that. And I think we've actually changed a number of things relating to prejudice that would have existed previously. But I think that's nationally, when you look at the positive work that's been done about gender. I think the fact that we know there's a problem, and instead of trying to just say, okay, that's not really something that we're going to deal with because it feels a bit daunting and it feels huge, and is actually to say to people, no, I want to hear your stories, and then creating the confidence in people. And my experience is, if we can create that confidence, people will speak up. So I think around that, particularly proud. And I know through Adam, actually, the work that you have been doing in regards to developing a strategy, which I think looks really exciting. And then the group, I suppose, actually, when I was I heard about the work that you've been doing with undergraduates, and actually I think that's really, really important, because they are colleagues of the future that will be having these conversations, and the experience for them needs to be different. So yeah, I think I'm really proud about how we have approached when we understand a problem, or when we understand there is a problem, we seek to understand what it is and how we can work together to resolve it. And this is one absolute example of that.
Absolutely. Brilliant. Thank you. So I completely agree. It's my personal mantra as well. Like, if I know there is a problem exists, I would know there is a solution there as well, and I can find out the solution. So you being the chief executive who has just agreed that this is a problem, you appreciate. I'm sure that there's going to be a solution. I've got full respect and to the potential of this organization. So thank you very much again for your time today, and hoping to see a better NHS Grampian in regards to equality, diversity, inclusivity, and racism. And I'm sure that this talk would encourage people and would feel them safe to speak up in the next available opportunity.
Thank you. I'm glad it's been useful, and I would be delighted, Sneh, if you would invite me to join you for some of those conversations with your colleagues, so that actually they don't just see me on a video, but actually they can see me in person, listening to their stories. And I will certainly find that really helpful in ensuring that it remains a key priority for us.
That's a great offer. Thank you so much, and I'll definitely do that. Thank you, Caroline.